Hello there, how are you today? This is to specially welcome you to the ATP question of the day. This amazing feature was put together by Ask the Pediatricians Foundation as a platform to answer some of the frequently asked questions by moms and dads pertaining to child health care. And Dr. Gbemi Sola, who is a consultant pediatrician and the founder of the foundation, would be addressing these questions herself. Amazing, right? Yes, I thought so too. So relax, grab a pen and a drink as we enlighten the world.
Hi friends, welcome to ATP question of the day. I am Dr. Gbemi Boyede. I'm your pediatrician for today. Okay, and I'm going to be addressing one of those questions that have been asked and that we think you can also learn from. Remember, you can always ask your question on our ATP Facebook group from Mondays to Saturdays, and we answer your questions. And of course, you can also watch all the ATP question of the day on YouTube and on Instagram, and you can learn from other questions that others have asked. This program is brought to you by Ask the Pediatricians Foundation, and our vision on ATP is to ensure that no child die from preventable causes of death, and that is what we do. We're looking forward to that. There's really in Nigeria, in Africa, in line with the Sustainable Development Goal 3, that no child should die from what we can prevent or what we can avoid. All right, so I've got a question for us today. Okay, so this mom is asking, and it's not only mom that asks questions, but most of the time I think my default is just moms. All right, apologies to the dads. Okay, I think I'll try and be sure who is asking the question next time. But I guess it's from a mom anyway. So, which type of circumcision for a male child is most safe and easy on the child? I have heard of the contemporary one and a ring one. I need clarification. So this is a very, very important question. Thank you so much for asking. All right, so the question about circumcision is a very important one because, especially in Nigeria, because we are a culture that's either religion or even culturally, we do a lot of circumcision, and it's very common. And I'm happy that the mothers say male circumcision, and that's so important to me because for the last two episodes, I've been addressing the issue of female circumcision, which I said is saying no to female circumcision. It's criminal, it's dangerous, it is not scientific, it is not even good for anything. So please don't circumcise our female children. Just let them be and don't press their vulva or anything. Just let it be. For the male children, however, for cultural reasons or for other reasons, many of us do female circumcision, which is fine. And what this mom is actually saying, that there are two methods. So what she called contemporary is what we call so I will tell you what we call it scientifically now. So we have what we call the surgical method. The surgical method is actually, as the name supplies, an operation. So the doctor, not necessarily a doctor, even some nurses who are trained and other health professionals who are trained, they use surgical instruments to cut out the foreskin. Circumcision is actually the removal of the foreskin of the penis of a male child, and so they remove it, and then you have to dress it for a few days, and it will heal. So that is what we call the traditional approach or the surgical approach. That is the normal. But we now have another method we call the plastibell. The plastibell is, I think that's what you mean by the ring method. It's like a little plastic where you kind of use it to push back the foreskin and tie, and then when the plastic drops, the foreskin is removed that way. So that one is not a surgical method. It's a plastibell method. Now, the question is, which one is the best? Which one is I would say that all of them have their own advantages and of course their disadvantages. The plastibell method sometimes is easier, and of course you're not going to need to do any dressing and all that, and the plastic just fall off and that's it. But sometimes it may fail, maybe either especially if you don't get the right size of plastibell for the child, it may not come out properly and all that. And so sometimes you now end up still having to do the surgical method. So I would say it depends on the expertise of the person who is doing the circumcision. So if the person is very good with placebo, fine, and it's also less painful for the child. But if the person is not, then you both of them are painful. Both times you have to use some form of not the typical anesthesia, but some kind of pain relief for the child. But the surgical method tends to make parents a little bit more, because of the blood and everything. So, but it's, to be honest, anyone you want is free. But most people these days actually go for the placebo method, but some do the surgical method. Also for children who have some abnormalities of their genitals, it's better that you don't circumcise them unless the surgeon has instructed you to do so, because sometimes they need to. For example, if you have a child whose opening of the urethra, the place where the baby pass urine from, if it is not at the tip, if it's at lower part, what we call hypospadias, then you really should not circumcise that child until you have seen a pediatric surgeon, because they may use part of the foreskin to do the repair. And because they're going to use part of the foreskin to do the repair, they need it to be done in a particular way. So if there are some issues with the baby's genitals when baby is born, then it's preferably that you don't circumcise until you've seen your pediatrician or the pediatric surgeon first, because they may need to guide you as to how to do it. But if your baby is otherwise fine, there's no issue, then you can just do any of the circumcision method that works for you. I think for you as a mom, that's not the most important thing. I think for you as a mom, what is more important is the care of the circumcision after it has been done, because usually the procedure will be done by the professionals. So the professionals does, whether it's the surgical circumcision, whether it's a placebo method, it should be done by the professionals. So when the professionals have done it, then you need to know what to do. So when it now comes to that, that is where maybe the placebo may be an easier option for mothers, because for the placebo method, you really don't do nothing. You just bath the baby normally and wait for the plastic to drop. That's all. And you just continue like normal everything where they happen normally. You don't need to apply no cream. You don't need to apply anything on anything at all. Just leave it alone and wait for it to drop. You bath the baby normally and everything is fine. But in terms of the surgical circumcised phallus, they may need to give you some instruction. You need to apply some oil or some cream on top of the penis, so that it's softer for the dressing when it's coming out and all that. And usually some of them will tell you whether you need to come for dressing or not, but most times I think they just want you to apply those oil, and eventually they may tell you, they will give you the instructions of what you need to do, and you just need to do it. But most of the time it's just to keep it clean and make sure that you don't allow the stools and all those things to soak into the dressing on top of the surgically circumcised phallus. I think that's the most important thing. But so whichever one you do, the most important thing is that you follow the instructions of. Please don't apply engine oil, which is one of the things mothers have done. Please don't follow people's instructions. People will tell you all sorts of nonsense. I've seen people cause a lot of, you can become infected. That infection can be dangerous, and some people don't allow quacks to circumcise your children. I've seen people who have amputated the whole penis because they are seriously, I've seen a lot. So, and I'm not exaggerating, seriously, I've seen them. So please be careful. Make sure you do your circumcision, preferably by a trained professional, preferably in the hospital, and let them use sterilized instruments so you don't end up having any difficulties. And if your baby has all the issues with the penis and all that, don't do circumcision. There's no emergency with circumcision. You can do it anytime. So you wait until you see your doctors and they give you the go ahead to do the circumcision. But so whichever method, the most important is a post-procedure care, and make sure you follow that. And if you are a first-time mom and you really want to know about all these things, remember to enroll for the FTM Baby Care Ready course. these are some of the things we discuss in this course. I'm sure you're going to love it. So till I come your way again tomorrow with another fresh episode of ATP Question of the Day, keep learning and bye for now.
How was it? I told you it would be enlightening, and yes, it was. So why don't you join us tomorrow for another edition of Question of the Day? And I encourage you to subscribe to our ATP TV on YouTube. You can follow Ask the Pediatricians on Instagram, join our Facebook group. Plus, we have an ATP mobile app on Google and Apple Play Store. Download it. Till we meet again tomorrow, thank you for watching.